The city's pledge to ease the homeless crisis and get help for those with severe mental illness could face a roadblock. There's a shrinking number of hospital beds available for psychiatric care. Morgan Mackay is joining us now. And Morgan, you were there with the mayor earlier today and talked to him about his plans to tackle the issue.
Natasha, a lot of questions still remain about how the mayor's mental health initiative is being rolled out. According to a City Hall spokesperson today, at least one person last week showing signs of severe mental illness was transported to the hospital, but getting these numbers in the future could be a challenge.
Mayor Eric Adams has been facing the heat over his new directive, which forces homeless individuals suffering from severe mental illness into a hospital for evaluation without their consent if needed. So he doubled down on Monday.
I didn't get elected to do easy tasks. I got elected to look at these systemic problems that have been in the city for generations.
But despite promising there will be a psychiatric bed for every person in need, the numbers don't match the mayor's pledge. During the pandemic, hospitals cut the number of psych beds to care for COVID patients, and many of them have remained offline. Kenneth Rasky, president of the Greater New York Hospital Association, which represents more than 250 hospitals, says he supports the mayor's plan, but when asked if he will make beds available, he wouldn't fully commit to how many nor how soon.
Psychiatric problems are like episodic issues, so you can't just allocate beds. The expansion is occurring through a natural process, but will we have to wrestle with other hurdles? The answer is absolutely yes, we will. But we will clear those hurdles.
The mayor also said there is no plan at this time to report the number of people who are being taken to a hospital for evaluation, making it hard to track the success of this initiative.
Within the limitation of revealing, within HIPAA laws or other laws that we're not required to report, we're going to try to be as transparent as possible.
But civil rights advocates pushed back on this claim that there would be a HIPAA violation when reporting the number of people being taken to a hospital for care.
We want to know the length of stay. We want to know whether they're admitted, whether they're not admitted, whether they're medicated, not medicated, whether they're connected with services, what services, for how long, whether the city is finding housing for them.
We also asked the mayor today if there would be some sort of accountability system in place. For example, let's say someone was taken to a hospital that didn't technically fall under this category of severe mental illness. He said that that individual would merely be connected to a shelter or other accommodations. Natasha?
All right, Morgan, thank you.